Hello, my name is Dr. Ruthie, or Dr. Ruth Newstifter if you want to be formal. I'm a professional sexuality educator and I blog over at exploringintimacy.com. But today I'm here thanks to the great folks at Funwares answering your very important questions on sex and relationships. So let's jump into the first question. We got it by email. If you would like to send me an email, I hope that you do. You can send it to the address right down there, AskDrRuathie at funwares.com, or you can tweet me at DrRuthie, DrRuthie. Let's see what was emailed in here. Hey, I would like to know, how can I do a prostate massage on myself properly? I've looked up many videos about it, but when I end up trying to do it, I have an intense need to go to the toilet. Is that weird? And when it is done properly, would I have a better orgasm? That is a fantastic question. And I'm guessing from your name on the email, which I won't read aloud, that you are male and are male-bodied. I'm just going to guess from your name, which is an important first start. In order to have a successful prostate massage, you have to have a prostate. And folks who are born with a penis and a scrotum generally have a prostate, unless they've had it surgically removed for some health reason in the past. So how to give a good prostate massage? Well, I have some really good videos on that in the collection. Hopefully you've looked at some of the other ones on Funware's YouTube channel that talk about how to do a good prostate stimulation massage. So let's address the specific question about the intense need to go to the toilet. There could be a couple of different reasons for this, maybe even more than a couple. So let me go over some of the most common ones that I hear, and hopefully this will help you out. Because for the folks who have talked to me about the addition of prostate play into their masturbation and sex play, they do report that they have a better orgasm with that prostate stimulation. Now, if they didn't have a better orgasm, they probably wouldn't keep doing it, and so they wouldn't be in that group to tell me about it. So, you know, it's possible that it won't work well for you, but it does seem to work well for most folks. There will always be exceptions once they learn how to do it. So the first big reason that sometimes people will have to feel like they need to go to the bathroom during prostate stimulation is because they may have to go to the bathroom. So my suggestion is to you to not eat within a few hours before you are going to do prostate stimulation play or exploration. Go to the bathroom and feel like you've had a good bowel movement. Some folks will recommend having an enema. This is totally personal choice. It's up to you. Keep in mind that enemas are used therapeutically for folks who are constipated, so you know it may make you have to poop more. So take that into consideration. Get to know your body with that if you decide to go that route. So making sure that you don't actually have to go to the bathroom is useful. Empty your bladder as well, of course. Don't be drinking a bunch of alcohol before this. It's not good to experiment with sex play when you're drunk anyway or tipsy. But, you know, alcohol has effects on the digestive system, both urine and feces, so we want to avoid a lot of those effects. So it could be that you have to go. Taking care of that will help you out. It could be that you're not used to the feelings of pressure or stimulation in your anal area or of the prostate. So it may be getting used to feeling those sensations and equating them to pleasure. If the only way that you felt any kind of stimulation in the anal area or around the prostate or bladder area is having to do with going to the bathroom, then your mind will jump right to that. Just like when I'm talking with women who are interested in having a squirting orgasm and they're really concerned about, did I urinate? Well, it's because they haven't felt anything coming out of their body like that other than urine, so their brain has to adjust to realizing that there's another type of stimulation happening there. So practice, lots of good lube, but making sure you're really aroused first. For most guys, you have to be really turned on before prostate stimulation, especially when you're just starting to explore it and get into it. So you want to do a lot of stimulation up front, pun intended and not intended, both meanings of that. And make sure that you're really turned on and raring to go before you start looking for that prostate. It'll be easier to find then and easier to stimulate, and you'll get more out of it if you're turned on first. Continue to stroke yourself while you're touching your prostate. A lot of guys will lose their erection while they're doing anal play. That's okay. You don't have to be hard in order to touch yourself. Just make sure you're enjoying that stimulation. So making sure that you're turned on, aroused, making sure that you don't have to actually go to the bathroom, and making sure that you're being mindful that your body may get confused and feel like it has to go to the bathroom because it doesn't really know what other kind of labels to put that stimulation until you've had more time to explore it. Those are kind of the big three that I tend to hear about from folks. If you are waking up to go to the bathroom throughout the night or having other things that might suggest a prostate problem, definitely go and talk to your doctor and have it looked at too. You know, it never hurts to be a little extra cautious, and you know, prostate problems are common for guys, especially as they age, so it's always a good idea to just get that checked into if there could possibly be any health reasons like that. I'm Dr. Ruthie. I hope that these answer your questions so that you can go ahead and enjoy more prostate stimulation, get lots out of it, have good orgasms, and not have the discomfort of feeling like you have to go to the bathroom. I'll see you at the next video. Thanks.